But for long-term feeding, you must consider mixing it. You have got to have a mix of commercial diet, fresh food, and raw foods. People have this problem when I talk about fresh food. They say, well, can I feed it human food? What do you mean by human food? Whatever you eat there's no such thing as dog food and human food. I mean, unless you're talking about what's in the packet. I mean, the meats are the same, the vegetables are the same, everything is the same. You can feed them, there's nothing wrong feeding off the table, there's nothing wrong giving cooked food. But you should never make sudden changes in the diet, especially if your dog or cat is doing well with the current diet. I wouldn't do a quick change. You should always consult your veterinarian if you're thinking of doing a sudden switch. You should, because there are problems when your pet is used to eating one type of food. You suddenly change it. Gastrointestinal problem is the most common. They get vomiting and diarrhea. And if nothing else you don't want to change, at least just add into it fruits and vegetables. When you do that, you balance a lot of the problems we see in dry dog food or canned dog food, which is the lack of fiber you get in fruits and vegetables, which is the lack of enzymes, which you will find in fruits and vegetables, which is the lack of a lot of minerals and cofactors, which you will find in fresh fruits and veggies. So add that in. If you say, well, tomorrow I'm going to continue feeding, that's fine, there's nothing wrong with that, but make sure you balance it off. The question was asked during the break. I'm considering feeding my dog raw food, but I don't want to be handling the meat. I'm worried about a lot of things. Worried about bacteria and this and that. And, well, we have all gone to the point where making it even more convenient for you now. Our range of raw food is for us to fill that vacuum. It's pasteurized, so we don't have a lot of bacteria. It doesn't spoil as easily. But I would always recommend when you open the raw dehydrated food, you should still refrigerate it because addiction doesn't use a lot of preservatives. You must refrigerate it. It'd be a good idea. It's only a small box. But because it's a small box doesn't mean it's little amount of food. When you add water, it makes 3 times as much food. It just swells up. It's like instant noodles. It becomes your meats and all that. But I'm even with my raw dehydrate, which I think is the way we should all be heading towards raw food, you still should add in fruits and veggies into the diet. I think you must do that. Nothing beats fresh, okay? We are a holistic practice. And when I look at disease or health or disease, I look at it from a holistic point of view. What is a holistic? Well, my spelling of holistic was the original spelling. It's spelled as in the whole person. We look at the whole dog. When you look at disease, you're not just looking at the disease. You're not looking at the signs or symptoms. You're looking at other things that may be contributing. For example, you try in the holistic to try and see the bigger picture. All disease are presented as signs or symptoms only. That's what we see. Symptoms are for humans, signs are for animals. Animals don't have symptoms because there's no emotion attached to it. When you have the emotive part, it's called a symptom. Humans have symptoms, animals have signs. It is very, very subjective because you're looking at what you're telling me, or I'm looking at what the animal is showing. It's not telling me anything, it's showing me. So I'm looking at the signs for the cat and dog. When I look at a cat that is sick, I don't take it out of the basket straight away. I just look at it in the cage first. Same with a bird. If it's sick, I don't take it out. I just watch it. Dogs the same. When they come in, I don't look at the owner, even though she might be very pretty. I look at the dog. I look at the dog the way it walks in. I look at the dog the way it comes onto the table. I look at the dog the way it's looking at me or looking at the owner. You can get a lot of information out of that. We need to, first of all, look at part of the whole picture is the external, sorry, it's in black, that shouldn't be. This top says external environment. We need to look at what do you feed it? Where do you put it? Where does it stay? These are all the external environment. The food he eats, the air he breathes, the water you're feeding him, the place where he sleeps. All that is important. And then we need to know this breed. What is it prone to? What are some of the genetic conditions that it's prone to? And next one, very important, emotional status. You know, dogs and cats have emotional problems, huh? They don't develop it. We give it to them. Dogs and cats, they catch your energy. If you have a very nervous energy, the dogs and cats are very nervous. If you are calm, the dogs and cats are calm. I get people coming to my clinic. I put the dog on the table. I'm about to touch it. Ooh, be careful, this dog bites. You do that, the dog will bite. If you just shut up and let me handle the dog, I'm fine. In my clinic, I usually don't use muzzles and all that. I approach the dog. I know how to approach the dog. My name is not Caesar, but my name is Lee. But I can read my dogs. I know how to read them. If the owner is very nervous with cats, oh, you gotta be careful, you gotta be careful, then the cat is gonna go berserk, huh? You just shut up and usually ask the owners leave the room. And by looking at animals' disease, you can tell whether they come from a very highly strung family, Cats and dogs that are constantly chewing their paws, licking, like cats always licking, they are very stressed. They are very, very stressed, these animals. Why? Maybe not you, maybe the environment. You get cats that have these mouth ulcers. They never clear up in the mouth. It's called feline stomatitis. Or cats that have all this bare area in the bottom or the back or the tail. They just keep chewing and licking and licking. You will never find these conditions in the wild. You find them in animals that are kept in more than one animal household. Cats that have all these mouth problems. You don't find them you are very rare in households where there are more than, there's only one cat. They're usually more than 2 or 3. These cats develop all this. It's a stress-induced disease. Because stress causes free radicals. They suppress the immune system. They generate a lot of inflammatory cytokines. Always, everything starts from inflammation. That's the external environment, that's the internal environment. Then you look at treatment. What do we look at? My first treatment is food. I don't rush for the cupboard and just take out all these drugs. If that was so simple, I'd be a multi-millionaire. Of all the diseases I treat in the clinic, my success rate for treatment, 50, 60%. Most of the diseases I treat are managed. I don't cure them. You can manage them. Skin problems in dogs is hereditary. If I can cure a skin problem, I'm going to retire. I'm going to Bahamas. I'm going to buy myself a $1 million yacht. Skin problem is the hardest to treat. You know why? Because you can't cure it, but you can make it look all right. It's called management. You can manage it. First thing we do of any disease, first thing I look at, diet, what you feed it. Secondly, then we do medications, but we balance it off with a lot of supplementation. I use a lot of vitamins, herbs, and all that in my clinic. Because I find that if you use too much drugs, you're going to have a problem. What happens when you stop the drugs? Well, it relapses. And sometimes when you give too much drugs, they die or develop kidney problem, liver problem, and all of that. And you're not allowing the body enough chance to heal itself. You're constantly suppressing, especially when you're doing symptomatic treatment. That is what Westerners have taught Asians how to do. We used to be holistic practitioners. Now we just treat the cause. It's called symptomatic treatment. You itch, I give you an anti-itch. You're in pain, I give you a painkiller. How easy is that? But are you treating the condition? No. You're not treating the condition. You're treating the symptoms. Holistic approach means I need to find out what is causing the problem. Everything from what you eat, to air you breathe, to the way you sleep, to the food you eat. They're all important. Other forms of therapies, we look at a whole range. Let's say I've got a dog with a slip disc, right? I give it some anti-inflammatories. What else can I do for it which is not going to injure it, which may help? We do acupuncture. We do laser therapy. We might want to do swimming later on to build up its muscle. Hydrotherapy. We do massages. There's a lot of things out there. It's not just in your four walls, a vet graduates and he has the answer to everything in the world. No, that's nonsense. That's absolute nonsense. You know, I realize the older I get, the more I realize I don't know, you know. I suddenly realize I only know that little. And in fact, I'm amazed every week something happens in an animal and I'm going, I didn't do anything, it just got well. Or something else happens. Or I thought it was this, but I'm sure it was something else. So every day we're challenged. And we must accept the challenge, not denying it. So a lot of us deny, no, that can't happen. No, we all start with a no. Cannot happen. It's like what? Since when you start walking on water? You always accept, because then I learn. If you don't accept, you'll always be arrogant. You never learn. And that's your failure in life, because you never grow. Living life is to accept, to embrace. And that's where you go from here to here. Chronic degenerative diseases, we talked about, from bad nutrition. DJD, joint disease. Cardiopulmonary disease with secondary changes in the heart and lungs. Diabetes, cancer. These are the ones exactly the same in humans. These are the ones that affect humans as well. So our dogs are mimicking us. Cats are a little bit more wild, so they don't catch as much as dogs. Dogs is like, you have this, I will have that. Cats are a little bit more, you're going to have your diabetes, I'm not going to have it. You know, cats are like that, right? You know, now you touch me for 5 seconds, that's enough. I'm going away. But dogs, oh, please, 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 hug me, more. The more you stroke it, the more you turn around. You know. You saw the cartoon, right, Garfield? Exactly like that. Dogs are a bit stupid. And that's why dogs, when they have a disease, they are so open. They're so open that everything that you have, they will catch it. Remember I talked about energy before, vibrational. Disease is vibrational as well. There's a signature to disease. That's why you can actually have a lot of people diagnosing disease just with a computer. There's a way of analyzing the energy that they get. Bioresonance is one of them. You don't have to tell me, but I know what's wrong with you. I hook you up, I analyze, I get your they get a feedback, I feed all the energy back in, I can tell you what's wrong with you. They got practitioners there in Malaysia and Singapore doing that. It's called quantum physics. It's physics. Because whatever we have goes out into the universe. They're quantum physics. So what dogs do, they are one big open channel. You are giving out all these energies of various diseases. They are just receiving. And when they receive, they act as a sink. And they play that role, I suspect. God created animals, especially the dog, to help humans. Because without them, we will die faster. They found that out. People with animals live longer. So let's say you have a stress. You have all these stress energies coming out. The dog will take part of it and put it inside itself. They do that. And they develop problems. Or, I know a lot of clients, they have heart problem. The dog has heart problem. Any vets here, you always get that? You have a dog or a cat with a problem, especially dogs. Then you slowly turn around and look at the owner, and you ask them, do you have any problems? They'll tell you. Sometimes, more than not, they have the same condition as a dog. I have a dog that is partially paralyzed in both legs, in the back. We checked it, I couldn't find out, there were a lot of problems. Then the owner says, you know, it's so strange. I got 2 daughters. One is lame in the right leg, the other daughter is lame in the left leg. The dog is lame in both. Strange, huh? Or you got arthritis in one knee, then the dog will have it in exactly the same knee. Or the owner is diabetic, the dog is diabetic. Or the dog has cancer, and the dog's cancer is stage 4, about to die. The owner has stage 3 cancer. Because if they didn't have this dog, the owner would be dead or have stage 4 by now. They trap that energy. I don't know how to explain it, but there's a science in there. I know there's a science in there. I know there's a science. So dogs are like that. Nutritional facts. Could be hereditary, congenital, can be made worse, stalled and improved through nutrition and nutraceuticals. I use the word nutraceuticals as opposed to supplements. When you use a herb or a supplement in a dose that can actually give you a quick response and like treating a disease, it is then falls into another category. It is then called a nutraceutical, as like pharmaceutical. It's like if you were going to buy bird's nest, all right? That is called a supplement. But if you take all the goodness out of bird's nest, you concentrate it, and you make it into an injection or a pill that will help you with a disease, that is then called a nutraceutical. We have shark cartilage, concentrated shark cartilage, in a suppository for cancer treatment. You put it in the backside, it absorbs through that. It is not called a supplement. It's not like your shark's fin soup. It is called a nutraceutical. To get the same amount of benefit of this chondroitin, this special chondroitin sulfate out of the shark cartilage, you need to drink 50 bowls of shark fin soup versus one suppository. Most conditions, if not all, can be stalled, that means you can slow it down, or reverse slightly, just through diet. So if there's a combination of diet, nutraceuticals, and medicine, what a fantastic marriage, huh? But do vets and doctors think that way? No. You get us versus you. When my vets first joined us, they practiced medicine called alternative medicine. They do bioresonance. He's a vet, but he does all of that. Bit of acupuncture. I'm a clinical nutritionist, but I taught them how to change that term. We should practice complementary medicine, integrative medicine, where I use a bit of drug, use a bit of herb, use a bit of acupuncture, a bit of TCM. Should that not logic give me a better result? Of course it does. I'm against alternative medicine. I think that is so wrong, that this is better than you. You are better. You know, that's nonsense. That's called arrogance. Arrogant people talk like that. Nutritional science, we can use, nutritional science means use like the food out there, hypoallergenic diet, no preservatives, blah, 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 plus all the supplements from naturopath. We can use it to correct deficiencies. That's the first thing, simplest thing, okay? This is not treatment, just correct deficiencies. We can provide nutrients in large amounts as pharmacological agents. That means they really act almost like drugs. These are called nutraceuticals. We can use it both in treatment and in prevention. Every day, I swallow 40 different supplements. I started off with maybe 3 or 4, but as we get more and more supplements in the clinic, one for eye, one for hair, one for this, one for that, and so on. The reason for that is 2. 1, it helps me, and secondly, I'm the guinea pig. I got to make sure when you take this long enough, it's not going to give me a problem. Some of them do, you know, and I stop doing it. I know, I can tell. When I add a new stuff in, after 1 week, 2 weeks, I'm suddenly feeling uncomfortable. I will stop giving that to my animals as well. This is the number 1 guinea pig. Or you can ask my company. I also tested all the dog food. Not all taste very good. And there's a brand of medicine called nutritional psychiatry. They do it in humans as well. I use it before when my son was still young. He's older now. It's very hard. He suffers from attention deficit disorder. Okay? And I know that if he drinks Coke or if he takes a lot of sugars, he will go berserk. Okay? If we stop that, we can stop that. That's nutritional medicine. You use that like medicine. And I know how to calm him down. Certain foods will have a calming effect. Certain soups will help him. These are all nutritional medicine. Some of the foods out there are for dogs with skin problems. It's not just they're hypoallergenic because they have a calming effect on some of the stuff in there. It has different people from different cultures will behave differently depending on the diet they eat.